Premier ministre Modi et gouvernement laine
BJP Legislature Party meeting elects Himanta Sama as leader of the Legislature Party. Sama to be the new Chief Minister of Assam. The Delhi government extends lockdown for one more week. Delhi Metro to be suspended for 1 week starting tomorrow as well. Partial corona curfew in Uttar Pradesh also extended till the 17th of May. The centre releases the first installment of United Grants to rural local bodies in advance in the view of the COVID-19 pandemic. A total of 8,923.8 crore rupees released to panchayats in 25 states. India's cumulative vaccination coverage exceeds 16.94 crore doses. More than 20 lakh doses administered in the last 24 hours. Meanwhile, the country records more than 4,000 COVID-related deaths for the second day in a row. More than 4 lakh new cases also reported yesterday. The Indian Air Force continues its COVID relief efforts. 2 cryogenic containers airlifted from Jakarta to Vizag. 2 C-17 aircraft on the way home with 2 oxygen generators from Bordeaux, France, and respiratory oxygen raw materials from Frankfurt, Germany. Hello and welcome you over the latest here on DD News and DD India. I'm Gautam Roy. Well, ending days of speculation, the Bharatiya Janata Party today announced that the senior party leader Himanta Sama will be the next Chief Minister of Assam. The announcement in this regard was made by Union Minister Narendra Singh Tomar after a legislature party meeting in Guwahati. Tomar was the BJP's central observer for Assam, along with National General Secretary Arun Singh. Sarma was elected as the leader of the BJP Legislative Party in Assam. His name was proposed by Sarbananda Sonowal, State BJP President and BJP MLA Nandita Garlosa at the MLA's meeting today. Let's now get more on this. My colleague and our correspondent Kamal Bora are joining us from Guwahati. Kamal, tell us, how did this decision come about? How did this entire process of the Legislative Party, how was it conducted? And when will the swearing in, the all-important swearing in, take place?
See, after election, 8 on the date.
I'm afraid that link with Kamal Bora is not going very smoothly at the moment. We'll try and reconnect, but this is the big news coming in from Assam at the moment. After the election results on the 2nd of May, the verdict had come out clearly. The BJP had retained its mandate in Assam, and then there was a question of who will be Chief Minister. The campaigning was ably led by Himanta Sama as well, and Sarbananda Sonowal also held his own end of the BJP's campaign in Assam. And ultimately, the decision has come from the legislators themselves in Assam from the BJP that Himanta Sama is their leader, and he will be now sworn in as Chief Minister. We are getting information as to when exactly that will take place. As soon as we have that information, we'll share that with you as well. But right now, you can see the images of the BJP Legislative Party meet with all the COVID safety protocols being held in Guwahati. Kamal Bora is with us again. Kamal, what can you tell us about when will the swearing in take place, and how did this legislators meeting really go that managed to elect Himanta Sama as its leader?
See, already I have mentioned that, after ending this speculation that lasted for about 8 days from the date of election, the election result came out. And finally, as it was expected, the Dr. Himanta Sama has emerged as a new face of the Chief Minister for the state of Assam, and he will run the state. And it was a long time. He was, dreaming for this for a long time, and today only the big day has come for him. And as far as the day, as you were asking that, when the swearing ceremonies will take place, definitely there is a chance for very much probability to, go for swearing ceremony tomorrow itself. And all arrangement has been done from the governor's side. He has also said before media that tomorrow itself it may take place, though officially no confirmed report has come out. But definitely we can say at this moment that tomorrow is the day when the new Chief Minister, Dr. Himanta Sama, will take oath. And let me tell you that, it was quite expected that the way this thing came out, the BJP for this election without declaring their CM candidate. It is quite obvious that both Himanta Sama and Dr. Himanta Sama both were a strong contender and both were equally eligible. It's not like you have only one of them, you have to go with only one of them. But both the contenders, they were strong enough, they were capable, both have own capacity, they have already proven their own capacity. And today, Himanta Sama, it was a demand of the people, the MLAs who have been 60 MLAs BJP has. Most of the MLAs have recommended Dr. Himanta Sama's name as Chief Minister. Even Sarvana Sonu, the outgoing Chief Minister, he also recommended the name of Dr. Himanta, the Chief Minister. But it shows how discipline the discipline is maintained in BJP's segment. BJP is always known for their own discipline, their own rules, strong rules. And they also doesn't, if we see other parties, if we see in Congress party, they also didn't declare the CM candidate. But we could see that we could say who could be the Chief Minister. But in BJP's case, since they didn't declare any CM candidate, people could only imagine that he or he may be Himanta Sama or Sarvana Sonu may be CM candidate. But it is only as far if we see culture of BJP, it is always decided by the parliamentary board. In yesterday also it was decided, but it was not declared before media, before public. Today only they have a culture.
The decision ultimately came from the MLAs themselves, the legislative party. But it was interesting how Sarvana Sonwal was one of the proposers of Himanta Sama's name as the leader of the legislative party. Now, what does the future hold for Sarvana Sonwal?
See, right now, what portfolio, who will get what portfolio, all these decisions will be taking place. Since still the all-party meetings are going on, all the NDA, elites of all the NDA party and BJP, AGP and UPPL, all the MLAs from all these political parties are going on. This NDA meeting is going on. So today, it's not sure whether they will announce the other ministerial candidates or not. But definitely, we are going to, witness the press conference or some statement from the BJP central leaders or some state leaders also. Then only we'll come to know that whether they will publish the names or not, whether they will announce the ministry or not. But yes, tomorrow they are going to take the oath. Definitely before that they will announce some name. But we have also have information that they will not. There will be a very short list. There will be only few ministers and few MLAs. They were going to take oath as a minister, but it will be again expanded. So this provision is also there. Gautam.
All right, Kamal. Thanks a moment for joining us. Do let us know as in when you learn as to when the swearing-in ceremony will take place as well. Thanks for joining us for the time being. Now, moving on, the cumulative number of COVID-19 vaccine doses administered in the country has exceeded 16.94 crores as phase 3 of the nationwide vaccination drive expands further. 10 states are accounting for 66.78% of the cumulative doses given so far in the country. 2,94,912 beneficiaries of the age group of 18 to 44 years received their first dose of COVID vaccine during the last 24 hours, and cumulatively 17,84,869 across 30 states and union territories got it so far as well. More than 20 lakh vaccination doses were administered in the last 24 hours. And with the vaccination drive crossing milestones, the efforts to track COVID-19 are still going strong as well. With better healthcare infrastructure facilities and test, track, treat method, a total of 30 crore 22 lakh 75,471 COVID samples have been tested for COVID-19 so far. Of these, 18 lakh 65,428 samples were tested on Saturday, that is the 8th of May. Meanwhile, India's battle against COVID-19 goes on. India has registered over 4,03,000 new COVID-19 cases in the past 24 hours, while 3,86,444 people have also recovered and been discharged during the same period. With this, the total number of recoveries has reached over 1 crore 83 lakh 17,000. India's total active caseload stands at 37.36 lakh, comprising 17.01% of the total cases. The COVID-19 recovery rate in the country now stands at 81.90%. And amid surging COVID cases in India, Germany has sent an oxygen plant with the capacity of generating 4 lakh litres of oxygen. The plant will serve DRDO-operated Sardar Vallabhbhai Patel COVID Hospital. German Ambassador to India, Walter J. Linda, inspected the plant. Linda said that India gave so much to the world during COVID pandemic, so it is just the act of returning this help. He also said that Germany stands with India in the fight against COVID-19.
Yes, you see, India has given so much during the corona crisis to the world, vaccines and medicine, so it's just an act of returning this help. So when we got to know that India needs mostly oxygen, we had our military getting into gear, and they brought in a big oxygen production plant. And I'm happy that the military working very well together with the Indian side, MEA, and all the actors which are here are working together, because we are all in this together in this crisis. You know, only together we can win it, and that's why we are here. So I don't want to make a big fuss out of it. We are just doing the help which is done among friends.
Now, the global community is also extending a helping hand to support India's efforts to meet the challenges and requirements of the unprecedented surge in the number of COVID-19 cases in the second wave of the global pandemic. A consignment of 3 oxygen generators and 1,000 ventilators arrived in New Delhi from the United Kingdom. To understand the emergency, the airport authorities have given customs clearance to the aircraft within 30 minutes of its arrival. The government has been ensuring global aid is being effectively and promptly allocated and delivered to states and union territories to supplement their efforts during this critical phase. 6,608 oxygen concentrators, 3,856 oxygen cylinders, 14 oxygen generation plants, 4,330 ventilators, BiPAPs, CPAPs and more than 3 lakh remdesivir vials have been dispatched or delivered so far. And to help India battle COVID-19, foreign aid is continuously pouring in. Global aid is being effectively allocated and promptly delivered by the Government of India to tertiary care institutions across states and union territories for COVID management. Director of All India Institute of Medical Sciences in Delhi, Dr. Randeep Guleria, has expressed his gratitude towards the countries who've helped India by providing necessary COVID relief medical supplies and equipment.
The All India Institute of Medical Sciences would like to thank all the foreign donations that have come in the form of oxygen concentrators and other equipment to help us fight the huge surge of cases that we're seeing in the second wave as far as India is concerned. I, on behalf of the entire staff and faculty of the Institute, would like to express our deep gratitude to everyone who has helped us in fighting this battle and working towards saving lives. Thank you very much.
And the oxygen expresses are also continuously supplying oxygen across the country with full dedication. The first oxygen express, carrying 4 tankers of liquid medical oxygen of 20 metric tons each, reached Kanpur before schedule. Another oxygen express reached Varanasi this morning. This was the 6th express sent to the holy city from Durgapur. Oxygen will be sent to various hospitals to fulfill the need of COVID-19 patients across the city and nearby areas. The oxygen express from Angul district of Odisha also reached Nagpur this morning. This oxygen will provide great relief for COVID-19 patients in Maharashtra. Meanwhile, the surge in COVID cases has prompted many state governments to either impose restrictions or continue with lockdowns to break the chain and ease the pressure on the crumbling health infrastructure. In order to contain the spread of COVID-19 and reduce the number of cases, the Delhi government has extended the lockdown in the national capital by a week till 5 a.m. on the 17th of May. During this period, Delhi metro services will remain suspended. Earlier, the Delhi government pushed the lockdown till the 10th of May. Announcing the extension of the lockdown, Delhi Chief Minister Arvind Kejriwal said that the national capital witnessed a reduction in cases during the restriction period. He also said that oxygen supply to Delhi has also improved. Meanwhile, Uttar Pradesh has also extended a partial corona curfew across the state till the 17th of May. Essential services will be exempted as before. The curfew may be extended further for a week as well. Chief Minister Yogi Adityanath can take a decision to extend the lockdown in the review meeting to be held with Team 9. Earlier, the weekend lockdown has been extended till the 10th of May. In Goa, a 15-day statewide curfew imposed this morning to curb the spread of COVID-19. During the curfew, medical shops and grocery stores are allowed to remain open from 7 in the morning till 1 in the afternoon. There is no ban on the operation of banks, insurance, customs clearance, ATMs, microfinance institutions and medical as well as health services, veterinary hospitals. Laboratories are also exempted from the purview of the curfew. The state administration has banned several activities while allowing the essential services, hospitality sector and medical facilities to remain operational. People entering Goa will have to provide COVID negative certificate for a test done maximum of 72 hours prior to entering Goa or full vaccination certificate. And in the Union Territory of Jammu and Kashmir, authorities today extended corona curfew by 7 days in all 20 districts of the Union Territory. The curfew will remain in force till 7 in the morning on the 17th of May. The curfew will be strict except for a few essential services. Further, gathering permissible for marriages has been reduced to 25 only with immediate effect. And Prime Minister Narendra Modi today spoke to Chief Ministers of Punjab, Karnataka, Bihar and Uttarakhand about the COVID-19 situation in their respective states. Chief Ministers have also briefed him on the measures being taken by them to deal with the raging second wave of the pandemic. For the last few days, Prime Minister Modi has been speaking to state chief ministers and lieutenant governors of union territories to assess the pandemic situation there and offer suggestions. In Bihar, vaccination of those between 18 to 44 years of age began this morning. Vaccination will be available at the nearest health center. Prior registration and slot booking is must for getting vaccinated. Bihar has received 3,50,000 doses of COVID-19 vaccine for persons in the age group of 18 to 44 years. And vaccination drive for 18 to 44 age group also resumed in Chhattisgarh this morning. Chhattisgarh had stopped vaccination from the 4th of May after the High Court objected to the state's policy of vaccination based on economic status. Disapproving of the state government's decision to stop vaccination in the age group of 18 to 44 years, the Chhattisgarh High Court on Friday ordered that the state should resume the vaccination drive immediately and provide vaccination to Antyodaya card holders, BPL and APL in a 1:3 ratio. In Now, the Department of Expenditure, Ministry of Finance, has released an amount of 8,923.8 crore rupees to 25 states for providing grants to rural local bodies. The grants are meant for all the 3 tiers of Panchayati Raj institutions, that is village, block and district. The amount released on Saturday is the first installment of the United Grants for the year 2021-22. It may be utilized by the RLBs, among other things, for various prevention and mitigation measures needed to combat the COVID-19 pandemic. Thus, it will augment resources to the 3 tiers of panchayats for fighting the pandemic. Now, according to the recommendations of the 15th Finance Commission, the first installment of United Grants was to be released to the states in the month of June 2021. However, in view of the ongoing COVID-19 pandemic situation and at the recommendation of the Ministry of Panchayati Raj, the Ministry of Finance has decided to release the grant in advance of the normal schedule. Moreover, the 15th Finance Commission had imposed certain conditions for release of United Grants. The conditions include online availability of accounts of a certain percentage of rural local bodies in the public domain, but taking into consideration the prevailing circumstances, this condition has been waived for release of the first installment of the untied grants. Now, the Defence Ministry has issued an order to the Directorate General Armed Forces Medical Services for recruitment of ex-Army Medical Corps or Short Service Commissioned Medical Officers. Under the Tour of Duty scheme, 400 ex-AMC or SSC medical officers released between 2017 and 2021 are expected to be recruited on contract basis for a maximum period of 11 months. The medical officers to be recruited are required to be medically fit according to civilian standards. Ministry of Defence has taken several steps to mobilize additional manpower to assist the civil administration to tide over the current COVID-19 situation. In addition, ex-defence doctors have been roped in to provide online free consultation on e-Sanjeevani OPD to all citizens of the country. At the same time, the Ayush Ministry has launched a massive nationwide campaign to distribute its polyherbal Ayurvedic drug Ayush 64 as well as Kabasura Kudineer to the majority of out-of-hospital COVID-19 patients. In a statement, the ministry said that the efficacy of these drugs has been proven through robust multi-center clinical trials. A multi-stakeholder campaign has been launched by Union Minister Kiran Rijiju to ensure that these medicines reach the needy in a transparent and efficient manner. Chairperson Interdisciplinary Ayush R&D Task Force Professor Bhushan Patwardhan has said that Ayush 64 has effectively shown to reduce the duration of hospitalization in COVID patients. And let us now take a look at the updates on the COVID-19 situation from across the world as well. Well, the virus has so far infected more than 15 crore 83 lakh people globally, while the number of recoveries stand above 13 crore 58 lakh. COVID-19 has claimed over 32 lakh 97,000 lives worldwide. The US continues to remain the worst affected country with the disease, above 3 crore 34 lakh cases of infection. The country has also lost over 5 lakh 95,000 lives due to COVID-19 so far. And in the neighborhood, Bangladesh has decided to further extend the closure of the land border with India for 14 more days in view of the COVID situation in India. The decision was taken in a meeting chaired by Foreign Secretary Masood bin Momen in Dhaka. Earlier, the government had announced the closure of borders with India for 14 days on the 26th of April. However, movement of cargo will continue through the land border. The sample positivity rate in the country was reported at 8.7%. Bangladesh is currently under lockdown, which has been slowly relaxed since it was first imposed on the 5th of April. Bangladesh reported 45 deaths and 1,285 fresh infections on Saturday. With this, the total number of infections has gone up to 7.72 lakh and the death toll has reached 11,878 cases. With widely spaced sun loungers and regular disinfections, Greece reopened its organized beaches on Saturday as the popular Mediterranean holiday destination eases COVID-19 curbs in preparation for the return of foreign visitors next week. Tourism accounts for about a fifth of Greece's economy and jobs, and after the worst year on record for the industry last year, the country can ill afford another lost summer. Spain has meanwhile lifted the state of emergency imposed last October in all but 4 of the country's 17 regions. The state of emergency allowed the central government to enforce a nationwide curfew and local travel bans to contain rampant COVID-19 contagion. The decision to impose curfew was taken in view of the sudden surge in COVID-19 cases across Spain. Hundreds of people were seen partying in Madrid, welcoming the end of the curfew. People took to Sol Square, traditionally used to celebrate New Year's Eve, to cheer freedom, dance, play the drums and drink with their friends. In some other international news, former Maltese President Mohammed Nasheed is conscious after his life-saving surgery. His family said as police made 2 arrests in connection with a blast they said was being treated as a terror attack. Nasheed, the president of the ruling Maldivian Democratic Party and the current parliament speaker, was critically injured after a bomb exploded as he left his family home in the capital Male on Thursday. Police and prosecutors on Saturday said they had arrested 2 men linked to Islamic extremism in connection with the blast. The police said a 3rd man is wanted in connection with the attack, adding several others were involved in planning and carrying out the bombing. The birth anniversary of Gurudev Rabindranath Tagore is being celebrated today. Paying tributes to the Gurudev, Prime Minister Narendra Modi said, "On Tagore Jayanti, I bow to the great Gurudev Tagore. May his exemplary ideals keep giving us strength and inspiration to build the India he dreamt of." And that's all the updates that we have for the moment in this edition of the news. But for all the latest, do stay tuned to DD News and DD India and stay safe.